Well, good morning, everyone. It's 11:30, so in the interest of time and to be respectful of yours, we will get started here as Sam Elder is going to get us off to a start. So Sam, take it away.
Hi, everyone. Good morning. Thank you so much for being with us today. As communicators and journalists in the community, we know that each person attending this presentation understand the complexity of mental and behavioral health and the importance of accurately relaying that information to our news outlets. This presentation is very much so a collaborative effort between our regional affiliate boards, and you'll be hearing from many of us, including John Cummings of Warren and Clinton counties, myself, Samantha Elder of Montgomery County, Melissa Thompson of Logan and Champaign counties, Whitney Loftus of Preble County, and Brianna Wilson of Clark, Greene, and Madison counties. Today we'll cover quite a few items, including who we are and what we do, the current state of affairs, what's going on right now in this field, tips for reporting on suicide, mental illness, and substance use, and we'll have a brief discussion, share resources with you, and answer any questions you may have. Just to tell you a little bit about us. Earlier in the introduction, I shared with all of you that there are 5 of us represented today, but there are actually 50 behavioral health boards across the state of Ohio, and we are publicly funded through levy dollars. The 5 of us here today are always seeking opportunities for collaboration and coordination to better serve residents seeking help for behavioral health issues. So this is very important as we talk with you today, because we do want this to be a collaborative effort, and we certainly encourage all of that collaboration and partnerships with us. Our goals today. So we want to help you learn about the current environment and what we have found to be the best practices for reporting on suicide, mental illness, and substance use. To not only learn, but also understand the pressures journalists face when reporting on these complex issues. And lastly, we want to learn more about how we can support one another. I will now pass the mic on to my colleagues so we can go a little bit more in depth.
Thanks, Sam, and hello, everyone. As she mentioned, I'm John Cummings. I'm the Deputy Director of Communications for the Mental Health Recovery Board serving Warren and Clinton counties. And we really are excited to have you here with us today. Before we get started on what things look like in the media today, I want to set a baseline definition of stigma for you. There are lots of different ideas in both literature and among professionals in the field. So here are the ones that we're working from for this presentation. Perceived stigma reflects the way that people will behave with behavioral health issues, perceive themselves as being stigmatized and feel that they are experiencing discriminatory behaviors by others. There's also self-stigma among people with behavioral health issues. That is an acceptance of stereotypes and prejudicial beliefs based on what they see, hear, or read. And even a more basic definition comes from a researcher named Irving Goffman, who in 1963 called it an attribute that is deeply discrediting, that reduces someone from a whole and usual person to a tainted, discounted one. The stigmatized thus are perceived as having a spoiled identity. So the bulk of most people's knowledge of behavioral health comes from their interactions with media. It's one of the public's primary sources of information about lots of topics. So that's why we put this presentation together to help build your knowledge a little bit more as well, and then help where we can to bust those stigmas that happen as a result of some of the reporting in the past. Let's take a look at some of the common depictions of behavioral health issues that we've seen in the media. We have come a long way, but mental illness was once covered as disruptive, and people living with mental illness had to be isolated in the ways that they were reported on. That's how people perceived them anyway. With substance use disorders, they were rarely mentioned early on, and we didn't get a lot of information about them at that point. And when it comes to suicide, people who died by suicide or attempted suicide, as it was covered in media, were depicted as resulting from character flaws that they, for some reason or one another, might have had a bad character issue with themselves. Some of the things we used to see a lot more of as well in media were things like people with depression are always suicidal, or all people with schizophrenia hallucinate all the time. Even those with mental illness were depicted as disruptive, or they were always perpetrators of random acts of violence, or labeled as crazy, and to the point of having to be isolated from society. One psychology professor from the University of California, Berkeley, named Stephen Hinshaw, noted in his studies that some of the worst depictions of people with mental illness called them incompetent, dangerous, or slovenly. So today, people are living with mental illness sometimes are still depicted as violent. Substance use, of course, can also sometimes be shown as a character flaw, as we talked about, or the result of an economic condition for every person that is having a substance use disorder. And people living with mental illness look different in some depictions, in some media, TV shows and movies come to mind, or they act childish. Other inaccuracies include missing earlier addictions in people who may have some new substance addiction that is the focus of the media portrayal, or portraying persons who attempt or die by suicide as attention seeking, that that's the only reason that they're trying this. And people living with mental illness are depicted as prone to hallucinations or perpetrators of random acts of violence, as we discussed. Journalists are still learning, but they're also beginning to change the way that they portray these behavioral health issues in the media. We're seeing AP style books and other guideline sources counseling against glamorizing any issues that are happening, also counseling against sensationalizing what happens in the community when it comes to behavioral health issues. Stories are starting to include more resources of information for people who are in crisis, as well as helping other community members who are following these stories learn more about what mental illness, suicide, and substance use disorders are really like. And you're doing that by immersing yourselves in first-person experiences that really more accurately depict what's happening in behavioral health. Cindy, it gives a nice depiction of how she talks about the term suicide in this thing. And we can give her thoughts here. I hope you hear this.
Hi, I'm Cindy Price, and I lost my son in 2009 to suicide. It was the worst thing that had ever happened to our family. No one commits suicide anymore. They die by suicide. They suicided. Let's change that stigma. It's no longer a sin in most religions. It's no longer thought of as a crime. It's just like people die by heart attacks. They die by high blood pressure. So we try to use that same verbiage that they died by suicide or they suicided. Let's change the verbiage. It makes it a little less traumatic for families.
So my name is Brianna Wilson. I'm the General Manager of Marketing Communication for Mental Health Recovery Board of Clark, Greene, and Madison counties. There's lots of empirical research about stigma and reporting on suicide, but we wanted to open with not the data on why it matters, but from a personal perspective. So thank you, Cindy, for sharing your perspective and why language matters. Looking now to the more research empirical side, there are three main types of media influence when it comes to suicide. Today, we'll just be talking on imitation or copycat suicide. So another name for this is called the Werther effect. And it was first observed in the 18th century after the launch of God's novel, The Sorrows of Young Werther. So in the book, the protagonist suffers kind of an unrequited love situation and decides to end his life as a result. After the release of the novel, there were copycat suicides that erupted all across Europe, many with the book nearby, so next to them or in their pocket. As a result, several of the countries banned the book. And the Werther effect was first empirically investigated in 1974. Since, more than 100 studies worldwide have shown that the risk of contagion is real. Research suggests that copycat suicides are especially common between 3 days and 2 weeks after the event, if the story is on the front page, if the media consumer is of a similar age and sex or life circumstance to the individual who completed suicide. Interestingly, more common in print journalism, TV stories are 82% less likely to lead to copycat effects compared to newspapers. And we've also seen it more common if the person who suicided is a celebrity. So a 2018 study empirically investigated the link between media coverage and inflated suicide rates after Robin Williams' death. And death from the CDC showed a dramatic 10% rise in suicide rates in the month following his death. During this time, the study suggested that there were significant oversights in media coverage and non-compliance to reporting guidelines on suicide. The news isn't all bad though. So the Werther effects exist, but also the Papageno effect, which is on the next slide, exists. And that refers to any suicide protective impact of media reporting. So a recent study suggested that responsible media reporting can combat the Werther effect and prevent suicide. That can be done with media guidelines for suicide coverage. They first originated, the most effective and the first worldwide implementation of media guidelines occurred in Austria in 1987. After a sharp increase in suicide completion and attempts on the Vienna subway between 1982 and 1987, the Austrian government and the Austrian press agency collaborated to both produce and disseminate media guidelines for suicide. So within 6 months of that implementation, Austria had more than an 80% decrease in suicide attempts and deaths on the subway. And interestingly, the effects were long lasting. A 2007 study showed that the national decrease continued and is an 81% for all types of suicide every year since 1987. So Austria kind of led the charge, but this led the World Health Organization to release its first media guidelines for reporting on suicide in 1993, which acted as the impetus for other countries to adopt similar practices. It's worth noting that media guidelines don't just work abroad. So looking at Kurt Cobain's suicide, his celebrity status and really strong public adoration led to really heavy media coverage of his death. He was on front covers of several magazines. He had an entire issue of Rolling Stone. But it's worth noting that the media coverage in Seattle, which was his home city and his final resting place, diverged from the national coverage in that it included information about how individuals could seek help. So it offered an alternative solution. It included the crisis number of the Seattle Crisis Clinic. And as a result, that clinic received tons of calls. And in response, the clinic hosted a press conference with mental health and government officials to further spread the word about their services and promote help seeking. That led to a decrease in suicide imitation following Cobain's death, even despite the media coverage. So when we think about it, and we think about striking a balance, it's not that we don't want it covered, but just covering it in a way that will decrease or minimize the risks that are possible. So if we could go to the next slide, there are a few different versions of guidelines for reporting on suicide, but they are strikingly similar. These evidence-based recommendations on the slide came from the National Association of Suicidology, Ohio Department of Mental Health and Addiction Services, Nationwide Children's Hospital, and Ohio University's East W. Scripps School of Journalism, and they were released in December 2018. Some of the recommendations we've already discussed. So Cindy talked about the preferred language, using the died by suicide or suicided rather than committed. The research findings that we discussed show the importance of excluding certain details and of using kind of objective, non-sensational language. And as we saw in the Kurt Cobain example, including warning signs and local resources for those in crisis can be really powerful tools to help mitigate effects. A few other recommendations that are on the checklist include focusing on the life of the person rather than on the death and the method, framing suicide as preventable because we know that it is, and offering alternative solutions like getting help, and indicating that suicide is complex, is caused by many factors. That goes all the way back to the birth of the Werther effect, where really death was shown as the only alternative solution as this unrequited love. And we know that although it was simplified in the book, in real life, it's more complex than like that, that there are many factors that would lead to a suicide and many ways to intervene and stop a suicide. The last suggestion is conveying that suicidal thoughts and behaviors are not weaknesses or flaws, and that they can be reduced with support or treatment. So as you're working on articles about these complex issues, feel free to reach out to any of us at MS boards, including all of us presenting today, with any questions, or to reach out to clinical professionals as well. All of us are happy to help you in your reporting on suicide.
All right, thank you, Brianna. I'm Whitney, and I'm with the Preble County Mental Health and Recovery Board, and I'm the Community Outreach and Development Coordinator. So I think a lot of us have experienced lately just the influx of information that we all receive, and the fact that sometimes it's not always reliable. So today, the way that we seek and receive information relies heavily on being able to trust the source, but unfortunately, that sometimes the source is a social media post or an unreliable source altogether, and people are not always doing their due diligence, their own research or fact checking, just due to information not being readily available or not knowing how to find reliable resources. About 87% of Americans get information about mental illness from the media, which makes it ever more important that reliable and trustworthy information is being presented. However, it is found that most depictions of mental health in the media are found to be inaccurate, violent, and overwhelmingly negative. And this increases stigma and negative attitudes surrounding mental illness. And this negatively correlates with people help-seeking, or with help-seeking behavior, or in other words, people are not seeking help when it's needed due to feeling there are negative views associated with finding help. Our next audio clip gives a perspective of Liz, who is a client that shares her experience with mental health stigma and how that has made her feel throughout her childhood and into her adulthood, and her ideas on how the media can help with stronger stories regarding mental health in our communities.
Mental health has always been something that's been looked down upon. In my case, I suffer from depression and anxiety and suicidal ideation and self-harm. So when I was growing up, my parents would use the mental hospital as a scare tactic to try to get me to stop. And my dad had depression and anxiety, and he also had bipolar. So it wasn't talked about. You couldn't really talk about it with your friends or anybody because nobody would really get it. They just look down on you. I reached out for help when I had my daughter, and I've been in therapy ever since. I definitely self-harmed more during that time because I felt like I was so alone, that I didn't have a support system, that I didn't have anybody who could help me get through whatever it is I was going through at the time. I noticed now that people are trying to use TikTok and whatnot to try to get the word out that, you know, it's not something that should be hidden. It should be put out there. Mental health matters, you know, at the end of the day. Back then, it wasn't really talked about, for me at least, or in the circles that I was in, or the media that I was a part of. I don't think that they should sugarcoat it. I think that they should speak openly about it, because media is very important for those. It's like all around us. In fact, with COVID, it's everywhere now. And when they shelter it, it makes those of us who suffer from these illnesses, and not necessarily, it makes it harder for us to overcome it, because it seems like it's not okay to be feeling these feelings, but it's not okay to hide them either. It makes it worse, you know? Mental health has always been something that's been.
Okay, so it seems like Liz became isolated by the stigma that started within her own family, which then limited her resources from a young age and the ability to feel like she could talk to others. Had she received or gotten more positive and supportive information, she could have had a different experience and maybe gotten an earlier intervention and gotten help sooner in her life. So we're now going to talk about some person-centered language and other guidelines to use when reporting on mental health related stories or topics, because we want to most importantly remind the public and that we're discussing actual people and report the most reliable information possible. So using person-first language, he or she is a person who lives with schizophrenia, and not using the verbiage, he is a person with, or he is schizophrenic. I've gotten so used to doing it the other way, which I guess is a good thing. So they're not only schizophrenic, they are a person with schizophrenia who has feelings, thoughts, attributes that have nothing to do with their diagnosis. And saying that someone is a person with rather than a person is schizophrenic helps to define them as a person and not as their diagnosis. Ask yourself if mental illness is relevant to the story. Is the diagnosis of the mental illness actually pertinent to the story? If it is relevant, do you have an accurate diagnosis and depiction of their mental illness? Don't include a mental illness term or diagnosis if it is not relevant or accurate to the story. Consult with mental health experts with questions. They can help guide you to find factual resources and information, and I know that they're always happy to help. We don't want to refer to someone with a mental illness as psycho, crazy, or insane. And I think the word crazy gets thrown around very frivolously sometimes, and we all have to be careful about doing those kinds of things and using verbiage that in everyday conversation even can add stigma to our conversations and to people. Include resources in each article. This is really important because that could prompt someone to go find that article and read further and do a little research on their own. And it also shows that you're finding the most reliable information. Using words like suffering or victim. For example, she suffers from a mental illness. It's not person-centered, and it focuses more on their mental illness rather than them as a person. Use your local ADAMS board as a resource. We're happy to always point people in the direction of reliable information, to a clinical person, and to work with you as just a community partner. And we don't want you to guess when you have resources available. So don't make up resources, or if you're not sure if it's a reliable resource, don't just guess. Someone can always help you and is happy to help you find reliable information.
Good afternoon, everyone. I'm Melissa Thompson. I'm the Director of Business Operations for the Logan and Champaign County Board. And today I'm going to talk to you guys about the stigma related to substance use disorders and about what perceived control and perceived fault is. So substance use disorders are one of the most stigmatized conditions in the United States and around the world. And many times we see that people don't even want to work with, be related to, or see people with a substance use disorder. This negative view of people with a substance use disorder can attach a negative stigma to them. And these stigmas can result in poor outcomes in their recovery, which can actually make them less likely to seek out treatment services. And then in addition to that, if folks do actually seek out treatment services, people who experience a stigma are less likely to complete their programs and have a higher tendency of dropping out of the program earlier. So perceived control and perceived fault are the two main factors that affect the stigma placed on someone with a disease or disorder. And perceived control is defined as the degree to which people feel they are in charge of their own lives, instead of feeling helpless, hopeless, or buffeted by events or other people. And people who report that they have significant control tend to feel mentally and physically healthier than those who do not. And perceived fault is actually a little bit harder to define, but if we break it down, perceived means regarded in a specific way, used to say how something or someone is seen or thought of. So It's basically your perception of something. Then the word fault means weakness, failing, a physical or intellectual imperfection or impairment, and responsibility for wrong, doing, or failure. So in this case, what we're talking about, perceived fault, is viewing someone as being responsible for having a substance use disorder, and that the substance use disorder is in fact their fault. So the perceived control that a person has over their condition and the perceived fault in acquiring that condition can determine the type of stigma or the amount of stigma that's placed on a person with a substance use disorder. So for illnesses such as cancer, diabetes, or heart disease, most people are not going to stigmatize that because we believe that people have little control over having gotten that disease. So we believe that a person has acquired these illnesses through no fault of their own, and that they have little control over it. So that's that perceived fault portion. However, many people mistakenly believe that mental health conditions, including substance misuse disorders, are both within a person's control and partially their fault. And so for these reasons, they more frequently have stigmas attached to them. Next slide. So the language we use to talk about substance misuse shapes how the public views substance use disorders. The stigmatizing language can lead to negative stereotypes about the types of people who are affected by substance misuse and can actually decrease public support for prevention and treatment programs. But on the other hand, if we're using supportive pro-health language, we can help decrease stigma and increase treatment results. So paying attention to how reporting language can increase stigma. It can be difficult work and it can be hard to break habits that we've formed over time. So supporting the use of more respectful and inclusive language can be challenging. But having an increased awareness of the relationship between language and stigma would be the key to helping break the language cycle. So in order to start making changes in your reporting language, you can first start off by performing a language audit on yourself. So when you're reporting, what type of words are you using? Are you using the word addict? Are you using the word abuse? If you are, ways that you can easily change that would be to replace the word addict with a phrase that says a person with a substance use disorder. And you can replace the word abuse with the words use or misuse. And then also avoid describing urine screens as clean or dirty. Instead, you can use positive or negative, because that will avoid implying that it's a judgment of like a good versus bad on someone. In addition to that, you can train other reporters on reporting language related to substance use and stigma. So if you start to hone in on the ways that you and other reporters may be perpetuating stigma in day-to-day reporting, and even in just your general conversation, you can begin to change your perception as well. And that perception is going to be important. You can start to do this by asking them to think about what kind of perceptions they hold about someone with a substance use disorder, and the words and language they use when discussing individual stories while reporting. And then how can you explore alternative language? How can you then adopt the alternative language? So all of these conversations are going to be important to help bring self-awareness to you and others for your reporting styles. And so with careful attention to language, we can and will begin to reduce the burden of stigma surrounding substance use disorders and improve access to healthcare for people with disorders. So what we say and how we say it matters. Next slide, thank you. So here are some do's and don'ts for reporting guidelines for someone with a substance use disorder. These guidelines come from the Ohio Department of Mental Health and Addiction Services, and a lot of these guidelines are very similar to what Whitney went through earlier. So some things you can do is talk about addiction as a chronic disease and not as a character flaw. Keeping in mind that people who have repeated opioid use, it causes rapid changes in the brain. And so someone that is repeatedly using these actually need to take drugs just to feel normal. So if you can recognize that addiction is a treatable medical condition and understand that just like effective treatment exists for other diseases, like we mentioned earlier, heart disease, diabetes, you can understand that there is data around medication-assisted treatment, that combined with traditional counseling is incredibly effective in promoting wellness among people that have a substance use disorder. In addition to that, do not refer to using medication to treat an addiction as replacing one drug with another. So in any treatment approach which will allow someone to be a productive member of their community, to work, to raise a family, to fulfill social roles, really should be a welcomed effort and applauded that people are continuing on with their day-to-day lives, even though they're using that medicated assisted treatment. So one of the things that we had stated earlier as well was to avoid the really stigmatizing language, such as using words like junkie or druggie or addict, or even a drug abuser. Those can just really be dehumanizing to people, and it implies that they have a problem. So in this area, if we begin using that person first language, such as a person with a substance use disorder, we're going to suggest that the person has a problem, but that it can be addressed. And then also avoid using photographs and other images that depict active drug use. These images can be a trigger for people that are already in recovery, and it could inadvertently end up shaming people into not seeking help. Also, another thing is to don't assume that the readers, viewers, and listeners actually know where to turn for help when they need it. So try to make it a habit to include resources at the bottom of every article or in your newscast that include local treatment and recovery resources. You can include contact for your local Adams board, local treatment providers, information on how to download and access your local Get Help Now apps, include your local or national crisis hotlines and crisis text lines. Any of these or all of these are going to be excellent resources for the local community so that they can understand how and where that they can get help and support for treatment and recovery services.
So this is our audience participation part. We'd like to get some feedback from all of you to a few questions, and please feel free to use the Q&A box to answer some of these questions for you. Are you familiar with all these reporting guidelines that we've gone over here today? If so, which ones have you used, or which ones are you most familiar with? You can go ahead and put some answers in the Q&A box. Is there anything in particular that you use or that you are more familiar with as you get stories that come in around these issues? No one wants to be first. Thanks, Tom. Yeah, some things you're not very familiar with, that's okay. You know, AP Style Book has a lot of information that goes along with that to help answer different things and give you some things. It's good to know that you're very sensitive about these things, and that's really appreciated. Lauren, thank you. You regularly consult with your Adamus board. Excellent job. Thank you for that. That's good. We appreciate that. And, you know, we're always a reference for you. If you ever need to get a question answered about things, we can always put you in touch with clinical staff as well. Thank you both. So what challenges do you find when you're reporting about suicide and substance use or mental health concerns, what types of things, do you tend to question when a story comes up with these issues involved? Can you tell us a little bit more about those things in the Q&A? Sometimes can be long to type, right? Thanks, Lauren. Yeah, the word abuse can be inappropriate sometimes. And, as we were talking about, as Melissa and Whitney were talking about, person-first language is really important here. When people are discussing behavioral health issues, it's the person living with a mental illness or with a substance use disorder. And again, not using committed suicide. Those were important distinctions here for us. So thank you for sharing that, Lauren. I appreciate that. So the last question we have for you here is, what can we do to help support you? Learning some of these guidelines may be helpful, but are there things that come to mind as you listen to this information here today that spur other questions for us as we go along? We can always work to improve how we support you as you write your stories and do things in the community. Thanks, Tom. That's true. If suicide should be reported on at all in general, I appreciate that comment. You say you only report on it if it's a public incident. It hasn't happened in a long time. And I'm sure, yeah, it happens that you use the word addict or committed suicide. It's sometimes ingrained in us, and that's some of the things that we're here to help you with in helping to change that stigma that comes along with some of the terminology that's used. So yeah, things like committed suicide, we want to try to change that as we go along and remember that the person died by suicide rather than committed suicide. All right, thank you. Thanks for sharing that, Tom. I appreciate that.
I think that's actually a really great question that Tom brought up about whether suicide should be reported on. And I think it goes back to one of the quotes from the beginning of the slides that talks about it's not that the mental health community wants suicide not to be reported on, because not reporting on it makes it seem a little bit like, oh, it's a dirty little secret, or we often hear from suicide loss survivors that people don't know how to talk to them about it, and it makes it harder because it makes them feel like they can't talk about it because it's more stigmatized. And so in some ways, not reporting on it can actually increase the stigma. And so I don't think it's so much not reporting on it, but just making sure that you're following the guidelines of how to responsibly report on it in order to minimize deaths, subsequent deaths by suicide.
I think too, it's an opportunity to kind of report on maybe not that specific death, but have a piece about mental health resources, and different information that maybe can just reach more people instead of reporting on the death itself as it pertains to that one person, just out of respect for their families and things. But it is an opportunity to kind of just put resources out there and support for others who may be experiencing issues.
I think that's a great point, Whitney. As we are seeing a rise in suicides, I think that is important to note that it's important more so now than ever before that this is at least being relayed to the community. And it's important to use this as an opportunity to discuss the resources that are available in your region.
And that's a great answer to London's question here when she says, generally speaking, substance abuse issues are dealt with in law enforcement terms in the area where she reports. So, what are some recommendations for working with law enforcement on the issue? Law enforcement is also trained, through some of the CIT programs. Those focus a lot on mental health, but they also deal with substance use disorders too. So they are learning that terminology as well. Certainly if, you're coming across police reports and things like that that don't use that terminology correctly, I would probably counsel on, saying, here's the way it should be when you report on it. The police report itself can use that terminology, but when you report on it, use the terminology that we discussed here today.
And I think it's worth noting, unfortunately, the stigmatizing terminology, committing or abuse, is still used, by even treatment professionals. So the mental health field itself has more work to do on it too. And it's really work that we all need to do together and help hold each other accountable. So regardless of whether it's me saying to John, oh, you slipped up, or having a conversation with someone in law enforcement, or talking to your fellow journalists about it, I think anything we can do to help raise awareness and check and balance each other is great, because no one's doing it intentionally. It's just people aren't always aware, or it's hard because of the societal culture to check ourselves all the time. And so I think that check and balance can be helpful too. I've just been willing to have the conversation.
Absolutely. Yeah, that's a great point. Lauren asks if we'll make the slides available. Absolutely. We're recording the session, so we'll be posting it on YouTube later, and we'll let you know where that's posted so you can share that with fellow reporters. And we'll also make the slides available to you as well. And you're also, go ahead.
Sorry, there's another question from Lauren. How can we effectively report on this around the holidays? Are there issues we need to bring to light? Is this a topic we need to stay away from? So I can start unless anyone else on the panel wants to share their thoughts. I think the holidays are a great time to talk about it. I know, especially when we think about low-risk drinking guidelines. So holidays often have a lot of drinking involved in them, and just making sure that we know drinking is okay, but there are limits, and actually recommended limits by the CDC called low-risk drinking guidelines. I think it's especially important right now to talk about it during this holiday season, because there is a lot of disappointment around this holiday season, a lot of uncertainty. It's just a very charged atmosphere right now with COVID. And I think it makes it even more important to talk about these issues, to talk about how do I help my children deal with the disappointment of not being able to see their grandma for Thanksgiving? Or how do we have a celebration alone that can still feel like we're supported? And, as people are more isolated, there are more mental health issues that are coming up. Even people who are generally mentally well might be experiencing challenges with their normal coping mechanisms not working as well as usual, or being additionally stressed, or having other effects. So I absolutely think the reporting around it and supporting the idea that there is help available and sharing those resources is a great idea.
Yeah, and along with that too, I think sharing like public and local resources for food banks and things like that is important, just because if people's basic needs aren't being met, especially during a stressful time, the holidays, and with everything else going on, then their mental health needs will suffer, or they, won't meet their mental health needs too. So if you're able to not post, but if you're able to share, just food bank resources, Thanksgiving dinner meals that are available to people too. And then, that kind of thing can help as well, along with the mental health resources, crisis lines, and things like that.
And I think those crisis lines are going to be extra important this holiday season. So like Brianna and Whitney both just said too, as things look a lot different this year, we could find people in a much more depressed state than usual, especially around Thanksgiving and Christmas and not being with their families. And so if you do have to or report on anything regarding suicide or regarding substance abuse, I would highly encourage you to make sure that your local crisis hotline is included at the end of your report and any type of local treatment resources, just so that people that might be reading it know exactly where to go and how they can turn for help. Or even if you just want to share individually or write some articles around the resources that are available for people. So maybe they'll kind of see that as positive messaging, that there are options out here and there are resources out here for me during this holiday season.
And I also think it's important to note that we're approaching seasonal depression. We're approaching, a lot of people are still uneasy about the election and have a lot of thoughts and feelings about that as well, and maybe in a depressed state or anxious state as we continue to move forward with the results of the election. So I think there are just a lot of factors right now that are playing into individuals' mental state. So when you're reporting on this, just remember that there's lots of layers out there, and it's a very complex issue, and that a lot of people, if we're looking at the African American community, they are going through different circumstances right now that will be impacting them in particularly, and it's hard to understand exactly what that looks like for everything. It's not one size fits all. So I think that's also important to keep in mind when you're reporting on these populations.
All great points. That's really great. Thank you. Thank you, everybody. I can't add any more to that. I will say that I've seen some articles on the flip side for people who are introverted, and they're loving, the isolation too. So, there are, different ways of looking at all of this, but we do really appreciate you taking the time to ask these questions and share more information that we can offer you as well. So as we wrap up here this morning, or this afternoon now, it's lunchtime, we have a few resources here. All of the hotlines are listed here for our various RAB counties and boards. So please feel free to make sure you copy these down. We'll have them in the slides for you as well. But they're all very important resources as we go through this holiday season and into the new year.
Just a reminder, so we know that reporting on stressful issues can also be reporting. We always talk about first responders as law enforcement, fire and EMS, medical workers right now. And I think as reporters, you are all really on the front lines too. You're interacting daily with people who are on the front lines. You're hearing hard stories. You're bringing that news to the community. And so making sure that you're okay, not only including these resources in your articles, but also just checking in with yourself and making sure that you're okay on a daily basis, and knowing that it's okay if you're not okay, and it's okay to reach out for help.
Can't drink from an empty well. That's what I try to tell my peers.
That's great. I had never heard of that before. That's great. Any additional questions that you have, feel free to use the chat box or the Q&A box for those questions if you have any additional ones. But in the meantime, we want to let you know we're always available for you. Here are our contact information for all of the boards, myself, Sam, Melissa, Brianna, and Whitney. We're all always available to help you and work with you to help report on these stories and these issues and help the community learn as well. Well, no further questions. That's great. Thank you so much for taking time out today to be with us and learn a little bit more about these stigma busting things that we've shared with you today. Again, if you have any other questions, we're always available. Please give us a call or shoot us an email. We'd be happy to get in touch with you. Thanks again, everyone. Have a great day, and we appreciate your time. Take care.
Thank you.
Yeah.
Bye, everyone. Thank you.